NIH History of Healthcare Policy Insurance, Part 3, 1970 to 1979. By the early 1970s, inflation and healthcare costs were both growing. President Nixon put forth the Comprehensive Health Insurance Plan, CHIP, and other congressmen put forth others splitting support for any one reform. In 1972, Supplemental Security Income SSI program began providing cash assistance to the elderly and disabled. Social Security amendments that allowed people under the age of 65 with long-term disabilities and or end-stage renal disease to qualify for Medicare coverage. In 1974, the Hawaii Prepaid Health Care Act required employers to provide insurance for any employee working more than 20 hours per week, while the Employee Retirement Income Security Act, ERISA, exempted self-insurance employers from state health insurance regulations. The enactment of the Health Plan Resource Development Act in the same year required states to develop health planning programs to prevent duplication of services. This resulted in the widespread use of Certificate of Need programs. In 1977, the Health Care Financing Administration was established within the Department of Health, Education, and Welfare, renamed the Department of HHS since 1980. The National Medical Care Expenditure Survey of that year provided detail and data on how much individuals were spending health care. So during the 1970s, Kaiser Permanente Foundation met with Nixon to create the CHIP program that changed insurance, which is who's writing most of this story. 1980, 1989, and 1981, a federal budget reconciliation required states to make additional Medicaid payments to hospitals serving a disproportionate share of Medicaid and low-income patients. It also repealed the requirement that Medicaid programs pay hospital rates equal to those paid by Medicare, and required states to pay nursing homes at reasonable and adequate rates. The two types of Medicaid waivers were also established, allowing states to mandate managed care enrollment of certain waivers and groups to cover home and community-based long-term care. The 1982 states allowed Medicaid expansion with children who require institutional care but could be cared for at home. In 1983, Medicare introduced diagnostic-related groups as a potential payment system for hospital payment. The Emergency Medical Treatment and Active Labor Act was passed in 1986, requiring any hospital participating in Medicare to screen and stabilize all individuals presenting to the emergency departments, regardless of their ability to pay. Also, in 1986, the federal budget reconciliation gave the option for Medicaid to cover infants, young children, and pregnant women up to 100% of the poverty level, regardless of receipt of public assistance. 1987, 31 million, which is 13% of the population, are uninsured. 1990 to 1999. The 1990s were a decade of change for health policy in the United States. In 1990, OBRA 90 required Medicaid coverage of children aged 6 to 18 who were living under the poverty level. President Bill Clinton, upon assuming office in 1993, convened a White House task force on health reform, appointing First Lady Hillary Clinton as the chair. Health and Security Act was introduced in both houses of Congress in November but gained little support and saw much pushback from the Health Insurance Association of America. Other than national health reform proposals were introduced in legislature, McDermott, Wellston, single-payer, Cooper's proposal for management competition. The administration began approving Medicaid waivers, allowing statewide expansion, and many states moved toward managed care for service delivery. They also used the cost savings to expand the coverage for this previously uninsured. The Vaccines for Children program was established and provided federally purchased vaccines to states, allowing those parents who were previously unable to afford vaccines due to financial constraints obtain them for children. So the federal government is paying for vaccines in 1990s. The Health Insurance Probability and Accountability Act, which is HIPAA, not Privacy Act, but Portability Act, was passed in 1996, restricting the use of pre-existing conditions that health insurance coverage determined. setting standards for the privacy of medical records and favorably taxed long-term care insurance. In that same year, the Personal Responsibility and Working Opportunity Act, we'll go over that as well, removed the little link between Medicaid and cash assistance eligibility and allowed states to cover parents and children at higher rates. It also banned Medicaid coverage of legal immigrants in the first 5 years of living in the country with an exemption of emergency care. The Mental Health Parity Act of 1996 prohibited group health plans from having lower yearly or lifetime limits for mental health benefits than medical or surgical benefits. Side note, 1997, approximately 42.4, 15% are uninsured. In 1997, the Balanced Budget Act was passed and included. That was under the Clinton administration. Changes in provider payments to slow Medicare spending down to establish the Medicare Choice, renamed Medicare Advantage in 2003. The enactment of the state's Children Health Insurance Program, the S-CHIP, to provide block grants to states allowing for health insurance coverage of children who are low income but whose household is not eligible for Medicaid. Supplying health insurance for employed individuals with a disability and income of up to 250% poverty. Permissions for mandatory medical enrollment in managed care. And in 1999, the Ticket to Work Incentives Improvement Act extends states' ability to cover working disabled individuals with incomes above 25% of the poverty and gave some states the ability to impose income-related premiums.